I'll just show you some slides just so you know who we are and what we can help you with. I'm from the Denmark's National Investment Promotion Agency, and we are integrated part of the Ministry of Foreign Affairs, and we're around 60 people working across the globe. 20 people here in Denmark, based in Copenhagen and also in the other regions. And we help foreign companies in establishing here in Denmark, and also in doing strategic partnership with Danish stakeholders. Just a small disclaimer, we don't help with sales because there's so many good private companies doing that, and we work for free, so we don't want to make unfair competition because we are a public organization. If you move to the next slide, please. What we can do is that we help you getting matched with the right people, universities, companies, innovation societies, business organizations, advisory experts, and other ministries if you need so. So we are kind of all over the Danish life science sector, and I'm focusing on medtech and also digital health, partly also pharma industry. If you just move on to our services slide. Yes. You'll have all these slides. You can download them afterwards. So if there's something that I don't go through in depth, then you can find the information later on. And here you also have my contacts. So, and you're very welcome to contact me afterwards if you have further questions, or if you think that we can help you in establishing here in Denmark or finding some partners. But again, not sales. That is not something that we do. Switch. And about these slides, there's a lot of information. There is a lot of, they might seem a bit busy when we go through them. And that is because if you find certain information, you want to know more, and there's a lot of links, and you can go visit the right web pages yourself afterwards. So this is why there is a lot of text. Without text, it's difficult to find your way around in the slides afterwards. Yes. A few facts about the Danish healthcare system. It's a public healthcare system, as in many of the other Nordic countries. It's labeled a beverage system, also called a welfare system, and it's public tax financed, and there is a general coverage, so all citizens are covered with this system. So this also means that there's a high level of equality in access to treatment, and it's the system is often focused on budgets and costs. And there is free access to primary care in terms of general practice care and outpatient specialist care and hospital care. Patients' out-of-pocket expenditures cover the remaining 15%, which is often related to medication and dental care. And what is interesting too is that further on we had some years ago, we had a lot of different hospitals. There is a new tendency that we'll have bigger hospitals, but fewer hospitals. So they are more specialized. And that is in order to increase patient safety and quality of care, and of course, reduce costs. So we have closed down a lot of hospitals. And later on, I'm going to tell you a bit about the new hospitals that is being built at the moment. Yes, next, please. The Danish healthcare system has 3 administrative levels. We have a state level, which is responsible for legislation and national guidelines and surveillance and healthcare financing through the Ministry of Health. And then we have the 5 regions, and they are important in order to understand the hospitals because they're responsible for delivery primary care and general practice as well, and outpatient specialist care, and then of course hospital care. And then we have 98 municipalities, which are responsible for school health, child and dental care, home nursing, public health, prevention and rehabilitation. And each municipality makes health agreements with their regions to ensure collaboration across sectors. Next. And important for you to know is that the GP is kind of the gatekeeper in Denmark. In Denmark, all citizens have free access to general practitioners, and they are kind of a gateway to all healthcare services. You see here on the illustration how it works. I think in the future you will see that the GP is going to have even more responsibilities and also a demand for more digital services in order to do all the tasks that is needed. The GP is the patient's primary contact of, point to the healthcare system, and almost or approximately 90% of all medical cases are handled by the GP. Next, please. And a bit about the financing healthcare. This is an illustration to show you how it works. You have the block grant, which is 75% of all the revenue of the hospitals, which is covered. It's from the government and sent directly to the regions. And then there is something new called proximity grant, which is it's a way of encouraging the hospitals to use more telehealth. And reduction of the number of hospitalized processes per citizen. And there's a few other criteria. So whenever they fulfill these criteria, they get a bit more of the proximity grant throughout the year, and it changes from year to year. And early on, we had something called activity-based financing. That has changed. We don't want more activities. We want the right activities. And then, of course, the municipalities. Oh, that was a bit too fast. The municipalities, they have a co-financing around 20%. And they also receive block grant. And everything is covered by direct taxes from the citizens. Yes, please, next. And a few words on digitalization, because it's really important to know how that works in Denmark. We're very proud of it. And I know in the other Nordic countries, you're quite good as well. But this is just to give you an idea of where we focus and what is coming up the next years. And also what is kind of the basics in Denmark. There's been introduced a digital first approach in Denmark. You can switch to the next. Yes. Digital first approach, where there's a lot of electronic interaction and it's mandatory. Of course, you can get some help in the public if you need so, but it is really, we always use digital solutions whenever we can. And it's a way to make the society more efficient. We have a very coherent digital infrastructure and a wide range of digital solutions. And this is just to give you some idea of where you'll find them and which kind of digital solutions are the most common ones. We have a MitID, and there's a link so you can actually go visit it. It's a common digital secure login. So you can go on online banking, social services, and of course also access to your own health data. We'll move into that a bit later. And then we have citizen.dk, it's called borger.dk, and digital post where we receive all the information from the public authorities. And also you'll have some strategies here, so you can see what's next, what is coming up in Denmark. And there is a link here to the digital strategies that we have in Denmark, for instance, AI strategy and so forth. And yes, we're proud, and especially when we also ranked quite well in different benchmarks in Europe, but also worldwide. And especially during COVID-19 here, we have actually been moving on and working from home, receiving the healthcare we need, so forth, because we have this very great infrastructure. Next, please. Yes. Here is a slide showing you the digital infrastructure in healthcare. And what is important for you, of course, to know is which kind of electronic health record systems that we use in Denmark. It's not that far ago that in 2007 we had 23 different EHR systems, quite a lot. So we want to make it more efficient and have more integrations. So this is why we have narrowed down the number of health record systems. So we have Epic, the American company's solution, in some of the regions, in one of the largest regions, or the largest region in Denmark actually, and Region Zealand. And for the 3 rest, we have Systematic, which is, I think, they almost finished the implementation of it. So this is important for you to know if you want to, if you have some solutions that need to be integrated into the systems here. And you more or less always get the question: does your solution work with our health record systems? And then another important database to know is our shared medication record. It's called Fælles Medicinkort in Danish. And here you have the stored information about patients' prescribed medication in a medication module. And also you have a vaccination model where you can see not only as a patient or a next of kin, but also your healthcare professionals can see what you have got and what is waiting for you to get. And it's accessible for the healthcare staff that treat you, and of course yourself. And if you're a parent, you can also follow your children's information. And here's a link, so you have you can get some more information about how to integrate if you have a solution working on this. And we move on. And another important platform to know is sundhed.dk, health.dk if we translate it directly. It's a unique national health platform, and we have had it since 2003. And it's containing all the information, mental health as well, as a patient. And again, as a parent, you also access the information of your children. And it's in here, and it's, of course, it's the entire nation that has this access. So in here, you find your hospital EHR and your prescription medicine. The first question, if you want to be an organ donor, and you get your lab results and so forth. And during the COVID-19 lockdown, we had more services integrated into this platform. Online video consulting with lots of different healthcare professionals. And I just can assure you that more apps are coming up, and more applications into this platform will come up. It's Danes has really accepted it and is using it all the time. And the next important one to know about is the GP, the access to your GP. So it's kind of, you have your own GP in your pocket, and some of them you find the same kind of information in here. But you can also make up an appointment with your doctor here and do e-consultation and video consultation, which is new. And again, COVID-19 has helped us because there was a bit of resistance to online video consultations, but we had COVID to help us on that. So now it's implemented and it's really working well. And more features will come also into this online platform. Next, please. Okay. This is just, you might know already that we're using telehealth in Denmark quite a bit. And what we are doing is we're working on getting a national infrastructure to handle more telehealth. So, because as it is right now, we have a lot of different pilot projects. And of course, we want them to scale and become an health offer to everybody with the disease. So we're building this platform. It's not finished yet, but we hope it will be soon. Parts of it is already integrated, and what's important here to understand, it might be a small country, but still there's 98 municipalities and 5 regions and GPs who needs to work on this at the same time and get the functionalities to work. And they all agree on that this is a great idea. So it takes a bit of time to make the details go right. But I hope maybe this year or next year we'll have the full integration of this platform. And as a start, it will be COPD patients who will get this offer, and later on heart failure, wounds, and there are some other diseases in the pipeline or patient groups that will be offered this kind of service. And unfortunately, I can't answer what this means for other telehealth solutions. As it is right now, we use other telehealth solutions, and there are some different platforms that you can use with your technologies. But in the future, I think this will be kind of the one platform, but we will see. Next, please. Denmark, as in many other Nordic countries, is a health data nation. We have lots and tons of data, and we've been collecting it for years and years. And they are not easy accessible, especially in the States. They're very interested, and also in other European countries. If you work with a researcher from a Danish institution and you have a really social value project, then you can collaborate on health data and make great projects. But I just must say it's not easy accessible. Nevertheless, it's of great use for the society, and we use it on a daily practice. Otherwise, we wouldn't be able to have all these digital solutions integrated. I have one more slide about ProData that I want to share with you. And it's just because that we're really focusing on this in Denmark, and we want to have more data. And I have made 2 lists of some of the areas which is where when healthcare staff is already collecting systematically pro data, and there will be more patient groups that will be delivering pro data in the future, because it's such a great help. Also for companies, if they want to measure the effectiveness of their products. So there's a lot of different great usages for this kind of health data. And the last slide. And why we're so digitalized, there's a lot of reasons and a lot of answers to that. I have just want to show you a part of the answer here. We have Medcom, and they have been running their business, a non-profit and public institution though, but they're running their business for 25 years, and they're kind of the digital backbone, and they are making all the standards in Denmark, working across municipalities, regions, GPs. So they kind of designing the flow where you're offline to online and making standards. And then of course we have a lot of different databases and registers that is very helpful, because we've been collecting for years. Yes, Karen, over to you.
Thank you. I was hoping for a miracle, but no miracle occurred, so I will continue with my mobile phone. We have 98 municipalities in Denmark, and they're responsible for a number of primary healthcare services, as well as elderly care and social care. And as more and more patients are moved from the hospitals and back to their home, the services that they deliver, the proximate healthcare services, will become more and more important, and so will digitalization. Each company makes a health agreement with the regions to ensure collaboration across the sectors. Next, please. Next slide, please. Sorry, the slide before. Yeah, that's it. In the municipalities, they have patient journals, or it's called citizen journals in the municipalities, and it's the citizens' health records. And apart from one case, all the health journals are delivered by either systematic with Columna Cura or with KMD with their product called Nexus. Next slide, please. The municipalities are organized in an association called Kommunernes Landsforening, and they have made like an investigation into the readiness of the municipalities to work with different technologies. I will not go into a lot of details, but in this slide you get a very good idea about the technologies that are already out there and in full use, the ones that are on the way in, the ones that are being piloted, and the ones that people are just considering. I just found one place where I'm not really agreeing with this view, and it's on AI, because I've recently been talking to a lot of municipalities, and many of them actually already have AI solutions up and running. So that one has moved very fast towards the dark green area. Next slide, please. If I should say something about the newer tendencies in the municipalities, first of all, what I really would like to encourage you to do, if you have products that you want to sell to the Danish municipalities, please do visit the KL Videnscenter. There you find a lot of the support that they're giving to the municipalities on welfare technology or digitization of a lot of different things, even how to use AI, etc. So you can get a lot of information about the municipality way of thinking about different things, and that can be worth a lot. So please do that. And then just like a quick scan, you could say that one of the really big challenges that we have in Denmark now, we have had a long period with a lot of technologies and take-in of technologies and testing, and the move to actually scale it and implement it everywhere in the municipality is still tricky. There simply seems to be very difficult to make this uptake in an effective way and as fast as it's actually needed and as the management want to. So another good tip is that if you can offer support on implementation and have proved skills within that could also be very interesting for the municipalities. Then I have also experienced over the last year that the municipalities increasingly, they are aware of the MDR and they are increasingly asking for documented results. So it's not like it was 5 or 10 years ago that it was enough that you had your product out in 2 or 3 municipalities and that would be enough proof. They're actually looking for studies with documented results. And then another tendency is this focus on large projects, and this is probably also due to the fact that it's challenging for them actually to implement. So this huge deployment of, for example, telemedicine is something that a lot of the municipalities really engage in and use resources on. And then you have another tendency that you see is, and it has already been there for some years, but it's this grouping of municipalities grouping and exchange of knowledge, maybe exchange of test results, and to a certain extent also joint procurement. Next slide, please. So, are the municipalities all the same? And now I'm going to say something that is impossible to do, because 98 municipalities are you know, everyone are their own and in a different way. But let me just try to say something that is a bit the sense that I can make when I talk to the companies. When you talk about the large municipalities, it is not always the easiest place to get in, to get heard and to get a test case or even a sale. They have very long and many strategy and organizational processes that makes it very difficult to work with them. And the 6 largest municipalities in Denmark actually have a group for themselves where they focus on larger projects and work at a more strategic level. So they're not the easiest to approach with new technology. The middle-sized municipalities very often tend to be the first movers on technology. They try things, and some of them also manage to get it implemented. But there are also some of the municipalities that are first movers, then try things, and then so they have like a very dynamic level of welfare technology experts in the municipality, but they don't really manage to get a hold of the staff. And therefore, a lot of the technologies after being tested are just sitting in some kind of storeroom or something like that. So you have to be aware of that you have to kind of follow up on what have they done with other technologies. Some of the middle-sized municipalities are actually not first movers. They are waiting for the good cases from other municipalities. When they can see that a technology really works in some other municipalities, they're ready to take it up in their municipalities. Very often it's because they have chosen to be first movers on education or on garbage management or on other things. So most of the municipalities don't have the capacity to be first movers on everything. And then finally, you have the smaller municipalities, and as you probably understand, they have less economic resources to, and therefore they're less willing to take chances, to test, to they would very often be looking for the technologies that really have a good business case and has proven its worth in other municipalities. But you will find a few who are actually a bit more willing to take risks, and it could perhaps be because of their position, if they are on a small island or something else where they really need to do some kind of radical innovation to meet the needs. Next slide, please. Yeah, how long are the negotiation processes? That is a very good question. Many of the municipalities only procure or only buy technologies that answer a need that their staff has identified, and it's becoming more and more so that there has to be a need in the route. And this means if you have a value proposition, they will have to get back to find out, are there anybody in the route who have actually identified this kind of challenges, and could this be a solution, etc. And I think this is actually very sane for Denmark. In general, Denmark is a very consensus-oriented country, and this thing with decisions from management level and down to the roots and back to management level and evaluation by some consultants in between and so on. It takes time, and it's very difficult to say exactly how the decisions are made. And then I also want to say that a lot of the solutions that exist are addressing a specific problem, and I think that if you see it from the solution point of view, you can say that, but this is a problem that you can find in a very abundantly amongst elderly people. But because there are so many solutions around, the municipality sees that certain solutions are very good for a very specific group of people, and other solutions for another group of people. So, for example, if it comes to medicine dispensers or the like, they will have many different electronic medicine dispensers depending on the target group and their needs and abilities. So a lot of, because they buy fewer units, they manage to buy a lot of the welfare technology under the limit for EU tenders. And then also in the public sector, we have this ski-aftalen. And the ski-aftale is actually like a huge organization that is supporting the public sector to do procurement in order to get the best prices. But you see very little welfare technology in this ski-aftale so far, at least. And then if there are tenders, so let's say that they really decide to roll out a certain kind of technology, then you'll find the tenders both for the municipalities and the hospitals. You'll find them on udbud.dk. Next slide, please. And then I will give the word back to Anne Maria.
Thank you, Karen. Thank you. There are 2 questions here in the chat. Do you mind if we wait and we take them in the end? I hope that's a yes. What I'm going to talk to you about right now, it says, if you go to slide back, please. This is a bit about market access and new demands, and just to make, because there are some important notes here, and that what the competences are needed in getting really access to the market. That is boots on the ground. It's very difficult to sit in another market, another country, and do transactions in Denmark if you don't have boots on the ground. So the next couple of slides I'm going to show you, you have to bear this in mind, that you need, in order to know the whole decision maker dynamics, you need boots on the ground and need to know some clinicians, and because they're decision makers, and also to have the strategic coordination, you need boots on the ground and so forth. And there's different ways to do so. You can establish in Denmark, of course, and you can get partners, but not being a part of the ecosystem is really hard. Or you can get, of course, distributors, but your way in, you need really to integrate into the Danish healthcare system. Okay, next slide, please. Here's you'll find some information about procurement in the regions. We don't invest in Denmark help that much with procurement because there's other great people to do so. But here are some links so you can get a better idea of how it works in Denmark. And as with the municipalities, as Karen, she told you, you go to the udbud.dk and you see what's up. Because all bigger transactions and tenders, they are presented in here. And you also find a link to the Public Procurement Act, so you can see how it works in Denmark, because it's a European country, or part of the EU. And another important link is to get the region's joint procurement strategy. And that is a great thing, because they will see a tendency that the regions are working closely together about finding new products and doing joint tenders. So in here you can see the different strategic focus areas, And for instance, there's a great focus on value-added procurement, and they'll do different pilot projects to get more value into the procurement and more green focus. Sustainability means a lot also in healthcare. And of course, there is a special focus due to COVID-19 on security and supply chains, on critical goods. And then, of course, a focus on how to save money. And for this strategy, they want to save 1 billion Danish kroners, quite a lot. That is, I think, a focus I'll keep on going, but more or less in all countries, of course. And then all 5 procurement departments or regions, they have their own policies as well. And I've put in some contact information to the regional procurement responsibles and their organizations. And I can't give you, a specific way to get into this market and who you should meet, because there's a lot of different hospitals and they do it differently from one another. But because there has been some changes in how the hospital's been financed 2 years ago, they have more. They are more able to make more decisions themselves and how they want to do procurement if it's not really large procurements. So it's always a good idea, again, boots on the ground, discuss with the hospitals, the departments, to see if there is a true interest in your product. And they do have some liberty in doing some procurement themselves. Otherwise, if it's a big one, yes, then there's other regions that might be interested in this too, but then it's a tender. And then it's another ballgame. Next, please. And then a bit about the CE marking. As Karen, she told you, in the municipalities, they like documentation, and they like documentation even more in the hospitals. And this is why the CE marking is becoming more and more important for more projects and products, and especially with the new
Waarom
MDR.
zeg je het niks meer?
Yeah.
Oh.
Yeah, especially with the new MDR regulations. So there's a great demand for this, and clinical trials will be important for many products. I won't go into which products because you can find this information yourself and you know which product you're already selling. But something that is we're really looking forward to is that we're going to have a notified body in Denmark. The German TÜV Süd is going to establish in Denmark. And as it is right now, not only in Denmark, but in a lot of European countries, we're waiting to get this notified body because it is hard to get the right approvals that you need if you don't have a notified body. See, there's a question here. AMCOS is it? Yeah, AMCOS, that is mostly medical or pharmaceutical products. Next, please. Another important tendency is that we like private and public innovation. And there's a lot of different ways to do so. But if you're looking into creating value in different ways, and not only focusing on the traditional way of doing transactions with the public healthcare system, you should consider working in private-public partnerships. There's different ways to do so. There's strategic alliances, there's a long-term partnership, and of course, test and validation of new technology, and clinical trials, and innovative procurement. These are kind of course, research projects, the long-term research projects. These are kind of the public-private partnerships that we are focusing on in Denmark, and we're really looking also to Norway, where they have been working this quite some time and have some good processes in doing so. So you will see, in order to boost this, if you move to the next slide, there are some national initiatives We have Trial Nation if you're looking to do clinical studies, also in medtech and digital health in Denmark. They will offer you a service and how to do so, how you find the right departments, patients, and so forth. And they work for free. Then we have a unit for public-private partnerships. And they are especially helping the clinicians in doing this. Some clinician knows how to do it, and for others, it's a brand new thing. And then we have different innovation boards, and we have a forum for value-based procurement and so forth. But the interest is huge, but we don't have the exact standards and answers in how doing so. Next slide, please. This is about the new hospitals. As you probably know, there's been a lot of hospital constructions in Denmark, and it's been for quite some time. It's a huge amount of money, you would say, to build these hospitals, but it's also very costly to build hospitals. So they might not be as super as hoped. There will be modern hospitals, but they're still looking for digital solutions to make them into these super hospitals. But they might want to finance this in other ways than they had thought in the very beginning. We have 16 construction projects going on, and most of them has finished. I'm not saying that they still they are not looking for new technologies, because they definitely are. And innovation has been a big priority to all hospitals, but in the end also very difficult to integrate into a new hospital. And of course, you're thinking, how do we get access to the ones who are the decision makers in these new hospitals, so we can sell them or enter a partnership? And I have to say, it depends on the hospital, because they have different ways of dealing with this. If we move to the next slide, please. Here you can see a timeline on the construction work, and there are some delays. But most of them, they're quite far, as you see. But last hospital called Nyt Bispebjerg Hospital, which is a part of Copenhagen, they have an innovation department, and the man who is in charge of the innovation department, he's really looking for new equipment, and he is discussing with a lot of different companies, how can we deal with this? And he is very specific in his criteria, what he's looking for. He wants more integration, he wants more innovation, and so forth. I'll show you in the next couple of slides. But in different hospitals, they have, not all of them, but most of them have innovation departments. And that's a way to start, finding the innovation departments and discussing with them, what are you looking for? Can we be of interest of you in any ways? Next, please. Yeah, and this is a bit about the Danish ambitions for these hospitals, and also criteria and demands. So it's not all fun. They have to decrease the number of beds by 20%. And number of bed days has to be decreased as well. They only have single rooms now, and they don't have the staff to monitor all the patients. So there is a lot of demands from the politicians, and they need solutions to implement these criteria in practice. And they haven't solved all these different demands yet and these criteria. So this is a great way to engage in the communication with the hospitals, is to see what are their needs, what are their problems, can we, with our products, be of any help? And this is, of course, not a list that is, there's a lot of further criteria, but you need to speak to the innovation departments in order to understand their specific needs. But these are overall needs. Next, please. Oh, I have a question here. Can you please share the link of more facts? Yeah, you get all the slides here, so you can visit the pages yourself later on. So this is why it's we have tried to make it pretty interactive, this slide deck, so you can find the information that's most important to you, because you definitely don't have the same needs either. This is my last slide, and this is some links also to some strategies. Might seem a bit unfocused with strategies and very future orientated, but actually it isn't. The life science strategy is being implemented at the moment. So there's a lot of initiatives, and they describe how they are implemented. And if you need more further information, you're able to find the information. But then you know what the strategic direction of Denmark is. And when I speak life science, it's also pharmaceuticals. And this is not really treated in this this small webinar. But of course, there are some interest also for you guys. For instance, in health data, we say we want a more focus on health data. They should be more accessible and so forth. So what do we do? How do we deal with it? You can get some information in here about the different initiatives, and also which apps are going to be approved by whom and so forth, and which, how do we, which apps are actually presented by the public healthcare system as something that you can count on and you can use. And then there is also a link to the region's strategy on health tech and how we get more digitalization. And in here, there are also some great directions. We want more telehealth, no surprise. I guess that is something that you want all over. And also, but some few facts on what are the ambitions. 1/3 of all consultations should be supported digitally, and also with virtual consultations. Better use of health data, and they describe how and so forth. More digital tools and imaging, more artificial intelligence, and so forth. And in here, you also find some pilot projects in artificial intelligence that have been running in Denmark for quite some time. So you get an idea of kind of how mature is the market and what is kind of their reference to AI and so forth. Yeah, more focused on mental health as well. They are quite digitalized already, but they want to be even more digitalized and so forth. This was my last slide, and we still have some minutes for some questions. There was the first question. We need to answer that as well. You ask, are the two EHR systems systematically used in GPs? This is something that you use in the hospitals. Of course, they're integrated to what they use at the general practitioners' clinics, but it's mostly in the hospitals and not in the GPs and other clinics, private clinics, and so forth. And there is also a question for you, Karen.
Yeah, can you read it to me, because it's difficult from the phone to see?
Yes, of course, of course.
Thank you.
Are there examples of companies that have been able to scale to large municipalities after a first small-scale project?
Yes, there are. There are technologies that were started at small scale and in smaller municipalities, and now are also in the larger municipalities.
As an example, I told you about the telehealth. That started in the northern part of Denmark, in the region north, with municipalities, and it's now going to be on a national scale. So here's an example. So that happens.
That happens, and you can say that is a much more complex setting, but you also have single standing technologies that have become very popular. I prefer not to mention names, but they exist. Yeah.
Then There is a question, do you have a national program regarding patient safety and quality of improvement? If so, what is it focused on? Yes, we do. We can put some links in here so you can find it yourself. I can't by heart the strategy, but there definitely is. But it's very much on in the Ministry of Health, focusing on this. And I know that they are also focusing very much on how they can use digital tools to support it. But we can find a link and add it to the slide deck here. But mostly it's how do we ensure equality of health? How do we engage with the patients and make them center of what we do in the health system? And how do we work closer together next of kin? So forth.
Are there any more questions?
Don't think so.
No? Then I really would like to thank you, Anne-Marie, for an excellent presentation. Thank you very much. And I'm so sorry that I have met you in this very unprofessional way, but that was my destiny today, obviously. And then I would also like to thank the coolest colleague you can imagine, Christina, who in less than 10 minutes became the manager of this meeting. Thank you very much, Christina. I don't know what we would have done without you. Thank you. And thank you to all of you who have been listening. I really hope that we have given you some good information that you can use to continue your investigation of the Danish healthcare market. And as has been said several times, you will afterwards get a link to both the video again, so you can watch it once again, and you can also get access to the presentation with all its links. So thank you for today, and have a nice afternoon.
Thank you, and bye.
Bye.